everyone. Thank you for coming to this lecture. I'm going to talk about some ideas for managing obesity. I know you've already had a talk on some of the risk factors, so we won't be going into that. So overweight pets and people, both kind of a problem right now. Depending on which study you read, around 60% of dogs and cats are overweight or obese. Interestingly, that's about the same as the percentage of European humans, including the UK, are overweight or obese. So in dogs, we know that only half, maybe up to 60% of obese dogs who are put on weight loss programs reach their target health. And this was a study out of Liverpool where they have quite a good program. So similarly, in people, only about 1% of obese people, so not just the overweight, but truly obese people, will reach a healthy weight. And the more overweight you are, the harder it is to reach a healthy weight, which I guess is kind of intuitive. But why is this so hard? We don't seem to have a problem putting weight on. So the simple etiology of obesity that we all would sort of intuitively think is the more you eat and the less you burn it off, the more fat you're going to store, which is true. It does come down to that basic concept. So are these overweight pets caused by owner indulgence, owner ignorance? Do they just not aware, of what they should feed their pets? Well, actually, it's a multifactorial disorder. There's a lot going on with putting on weight, losing weight. You can probably see this graph is for humans. There's some factors in there we don't need to take into effect for our pets, but we and our pets in these countries do live, in first world countries, in what's called an obesogenic environment. We have high calorie food available, the attitudes, values, and beliefs that we have about our pets and our lifestyles do contribute to overweight. There is also an effect of satiety hormones, which I don't have time to go into too much, but I will touch on that a little bit, as well as genetics. Something like 40 to 70% of your body shape and type is determined by genetics. So there certainly is a factor of that. And I'll touch on the little bit that we do know about dog genetics and obesity. And there's also an effect of the gut microbiome, which I'll touch on as well. So, excuse me, the hard part, of course, is communication with owners, and the healthcare team may be reluctant to discuss obesity with owners. We're worried we'll offend them. We're worried that we'll upset them. We can be worried that they'll actually get angry with us, which I have had happen. We're worried they won't even believe us. So why don't people change their minds when given facts? When we tell them things that we know are true from research or about their animals, why don't they just believe us and make the changes we want them to change? Interestingly, when people are faced with facts contrary to what they believe or what they desire to do, such as smoking, people can be more determined to continue that behavior or continue with that belief. So if their self-confidence is at all rattled by the facts which intrude on these beliefs, doubt can actually turn people into stronger advocates. I'm sure we've all seen this in politics at times as well. So the discomfort and conflict this causes is called cognitive dissonance, to where you're kind of hearing one thing that might be true, but it doesn't fit with what you want to believe. So how do we deal with this in our owners? For starters, we need to make sure they're relaxed, they feel safe in the environment that we're talking to them in, which I know is difficult right now, but when we can get back in a consulting room, and that we have something in common with them, which we do. We both want their pets' well-being. So starting off, we want to listen to the owners, respect their feeding decisions, even if we disagree with them, respect their decisions before we discuss change. People are more liable to change if they can discover the facts themselves, and this can be pretty challenging when we're talking about pet obesity. So I'm going to talk a little bit about maybe how to help them recognize it. So providing references and pictures. Small changes are more likely to occur, so we're going to be happy with any progress that we make. It doesn't necessarily have to change the world. So there are steps for behavior change regardless of what type of behavior change we're talking about. One is called pre-contemplation, where there is no intent to change. There's no recognition of the problem. You know, my dog's not fat, smoking is not unhealthy, whatever the topic is, I'm going to continue with what I believe, and I don't recognize anything else. Contemplation, there's a recognition in this case that their pet is overweight, and they might be starting to think that they should do something about it. So this is kind of the thinking phase. And then there's preparation, where we're planning the actions, we're developing a weight loss program that meets the needs of the owner and the pet. And then the actual action, which is where you put the plan into use, you get a commitment from the owner and start using the plan. And the fifth, which is as important, certainly for weight management, is a follow-up with the owner. So owner's recognition of the pet's body condition score. I'm sure we all recognize that this is difficult. In one study, only 30% of dog owners recognized their dog was overweight. The PDSA did a study where 71% of owners of fat pets were shocked when they were told, which kind of might speak to maybe they should have been told more tactfully. A third of cat owners, and I think this could be higher in other studies, underestimated their cat's body condition, especially with overweight cats and with long-haired cats. He's not fat, he's just fluffy. And the PFMA, the Pet Food Manufacturers Association, said that 80% of owners thought their pet's body weight was perfect. So this is an interesting number I'll touch on in a moment. So part of what I think has happened is this Labrador and this cat is this has become what is normal. So normal becomes kind of what we accept as correct. So this is kind of, you know, if all the other Labradors look like that, then your Labrador is normal, even though he's actually overweight and not healthy. So again, with recognition, I thought this was an interesting study that I ran across. It's a little bit dated now, but in 1965, I'll just go back for a second here. The pie chart is what people feel about themselves. So in 1965 in the US, about half, a little over half of the people thought their weight was just about right. 38% thought they were overweight. And the little scales on the bottom is the percent that are actually thought to be overweight or obese, in this case, 46%. So little disparity between that and the 38% who are overweight there. In 2014, we have over 2/3 of the population being overweight, but again, a little over half think they're about right. So we're starting to get into quite a discrepancy here between the number who perceive that they're overweight and the actual degree of overweight people. And a couple of years prior to that, they also looked at how parents see their children. Now, in this case, the children, about a third of them were overweight, but 88% of the parents said their kids were about right, and only 12% thought they were overweight. This is pretty similar to the studies in pets. We aren't recognizing obesity in our pets or our children. And our pets now are often sort of family members and kind of like children. So I think this fits. So how are we going to convince the owners? It's difficult. Comparing them to their previous weight, their previous shape or body condition score, if you have those recorded. Using weight charts, much better than numbers, especially for cats. That 50 grams may not sound like that much, but if you chart it out, it is a considerable amount, say on a cat or a small dog. So the more visual you can make the information, the more impact that it has. Some people compare the weight gain to what it would be for a person. I'm not actually comfortable with that, and I don't do it. If it works for you, that's fine. I don't do that one. Using body condition score sheets, demonstrate how to perform a body condition score. Don't ask the owner what they think it is until you've done that, because all of their pets will be a 5/9, maybe a 6/9 at the most, no matter how overweight they are. The owners often do not pick the right number. Hopefully you're all familiar with the wasava.org Global Nutrition Toolkit body condition score charts. These are free for you to download, use in your practice, put on the wall, hand out to owners, point to the picture that you feel that the pet is. So again, we assess this by palpation and appearance of the animal. So if you are able to do a consult with the owner and the pet together, or when you can do that again. Put your hands on them, put their hands on them, show them that it should be the flat of the hand against the dog, not plunging their fingers in perpendicular, and that they should be able to feel the ribs. And another good way to assess this, or if you wanted to talk through it on the phone, this can help too. It's not exactly a 9-point scale, but the ribs should feel like the bones in the back of your hand, the metacarpals in the back of your hand. So they should be able to feel them as though they're rubbing their hand across the back of their hand, assuming that they don't have really fat hands. If it feels like the knuckles on the top here, that's too thin. If it feels like the fleshy part of the palm, that's too fat. That's too much covering over the ribs. So obviously, you're going to weigh them, make sure that your scales are calibrated, try to use the same set of scales each time, which provides consistency. When you can, weigh with the owner present so they're actually seeing the number on the scales, and encourage the owners to buy scales. You can buy scales that go up to 20 kilos or so for cats and smaller dogs that aren't too expensive online, especially if you buy baby scales rather than pet scales. Baby scales are pretty much the same thing and are cheaper. So pre-contemplation, if you remember, that was a second step to where they're thinking about it. We want to make sure there's no other medical problems, discuss the disorders associated with overweight and obesity. Pre-contemplation is before they're planning. I got ahead of myself there. So we're still trying to convince them that there is some excess weight. So discuss the disorders and don't use cute terms. So especially say with brachycephalics, they're often described as adorably plump. Some of the breed standards don't even ask for these dogs to be lean. But we need to get across that, especially brachycephalics who can't breathe when they're overweight, that it's a problem. It's a medical problem. Avoid harsher terms. Try to say they're overweight. Fat is now thought to be, calling dogs or people fat is now thought to be pejorative. So be careful how you address this. Talk about some of the benefits, again, using this as positive and compassionate information about the improved health, that your animal will have a better quality of life, they'll be happier, they'll be more active, that they'll have fewer other diseases. And a study, 3 years ago now, showed longer life in a variety of breeds, anywhere between 5 months longer for some of the larger breed dogs to 2 years longer for some of the smaller breeds of dogs. So that to me is pretty good, convincing. And I don't know if you need to tell the owner this, but certainly they may not absolutely need to reach an ideal weight. So that goal seems a long ways away. Any weight loss can improve the quality of life and some of the associated disorders. In one study, the clinical signs of osteoarthritis in dogs was improved by only a 6% weight loss. So not a huge amount. And this can be reached by the vast majority of dogs that do start on a weight loss program. They might not reach their target goal, but you can probably improve the clinical signs that they have of other disorders. So the question I always get is, what if the client is overweight as well? How do we discuss this? Again, we're discussing the medical aspects of this disease about the pet. You just have to kind of swallow and go on with it and discuss it about the pet, and the owner can take that on board or not. We're not discussing the owner. So owner responsibility, owner guilt, we make sure we're not blaming and shaming. That will not help. We need to focus on future goals, not how we got to the overweight stage. We will talk about diet in a moment, but that's not the focus of this. And this needs to be a compassionate discussion, because you're more liable to get them on board. You're more liable to get them to stick to pursuing the goal. I'll talk just in a second about genetics. Some dogs are truly more difficult to manage with their weight, and just very briefly on the effects of the gut microbiome. So we know that there's quite a few genes involved in the regulation of weight in people. We don't know all the ones for dogs, but we do know, thanks to some brilliant work by Dr. Eleanor Raffin, that if there is deletion in one of the genes in about a fourth of the flatcoats, and about a fourth of the Labradors and nearly 2/3 of flatcoat retrievers, and the pro-opio melanocortin gene, the POMC gene, is this affects these dogs' appetite, and they will be truly hungry, especially in between meals. Now, in the Labradors in particular, this gene is associated with food motivation, and of the dogs in the guide dog training programs, about 75% of them had this gene deletion. So they're very food motivated, which makes them easy to train with food. But these dogs are legitimately hungry, so they will struggle more with this. Dr. Raffin also looked at the metabolism of some of the dogs with this gene deletion, and some of them have a lower metabolism. So at rest, they are using less calories than a normal dog. So they're struggling with a couple aspects of this. So you're not destined to be fat if you have this gene deletion or any of the other fat-associated genes, but the owners will have more difficulty with these, and these will be food-motivated dogs. When the owners tell you that they're probably giving you a true story. Just quickly on the gut microbiome, is it the bugs in the guts? The gut microbiota is all the gut flora, and there's a lot more than we used to think there were. The microbiome is all the bugs and their functions. And we've got different studies argue on this number, but about 100 times a gene and probably 10 times more cells in the bugs than in the hosts. That doesn't mean it's actually physically bigger, but it means there's more cells, probably by a lot. And we do know that the microbiome, the bugs in the gut of lean individuals, humans, dogs, and cats, is different from fat ones. Now, there's a lot of influences on the microbiome. The microbiome of the parent, the mother, the diet affects that, the environment affects it, antibiotics can really affect it, probiotics can affect it while they're being given temporarily. So, whether this is cause or effect of the diet or something else, we don't know yet. We just know they're different. One small cat study looked at the effect of a probiotic on the body condition score. It didn't really have any effect, but we might need different population. We might need more cats. We might need a different probiotic. We might need different diets. It's hard to know. So this will probably be interesting in the future, but we certainly no silver bullet for us right now. So are we ready for a change yet? So all of that was kind of working up to starting to think about it. And we may not be ready for change. We may still be in pre-contemplation, like not quite there yet to really work on a plan. The owner may need more than one visit to be convinced that there's a problem. So every time they come in, just try to address it again, go over body condition scores, show them what their dog or cat's weight has been doing, the percentage that it's gone up or down. Remember, they may be mentally kind of fighting against the concept with cognitive dissonance. Again, visual information is useful. Handouts, wall posters, pictures from success. This was a dog that I worked with last year whose owners did a brilliant job getting the weight off of him. Gently revisit improved health, activity, longevity. If you run a weight loss clinic, or if you have one that's available to your clinic, give the owners information about this. For human GPs, they found that if the GP gently suggested that an overweight patient consider going on a program, the reception was actually better than they thought it would be, that the owners, in that case, the patients, were pretty willing to consider it. We don't have that data for owners and their pets, but certainly say, look, we have this available. Would you be interested in being referred? So now we're going to get to planning. This is where we need to get an owner buy-in and commitment to a diet history. Hopefully you're doing that already, but I'll talk a little bit more on some of the stuff we need to include. Obviously the food they're eating, when they're doing it, the brand, the label, the flavor, the number of meals. Treats and human table food, always a tricky one. I find having them write it down is better than having them say it to me, because things will get left out. They are going to give you, as nurses, better information than they do the vets, by the way. Chew toys that can be chewed up. Dental chews can be really high in calories, so make sure that you get those on there. Food for administration of medication, so if they're on, meloxicam or something, it's often in the UK given in cheese. And different countries use different ones. The Scandinavians use liver pate. Licking plates. I consulted on a case recently where they were doing pretty well with the cat, and then the person in taking the history found out that they were letting the cat lick their plates, and the cat was getting little servings of gravy and butter, as well as everything else, which is going to hinder a weight loss program. So thank you for the person that told me that story. So planning for change, who feeds the pets? Are they getting food elsewhere, or is there competition? Does the dog scavenge? And again, these dogs with the POMC deletion, they're going to really want to scavenge. Does the cat hunt? Most outdoor cats are better body weight than indoor cats, but if they are picking up a few extra calories and eating what they have, we do need to take those into consideration. So in our approach to weight loss, sort of standard background assessment, such as the medical history, are they on any medications such as corticosteroids, anticonvulsants, progesterones, which could be driving appetite, the standard physical exam, including the weight body condition score, which I've talked about. Also, a muscle condition score is worth doing as well, and you'll find that on the WASAVA nutrition toolkit if you don't have that already. Standard minimum database, hematology, serum chemistry, urinalysis to make sure nothing else is going on. For dogs, especially middle-aged to older dogs, make sure they're not hypothyroid. Also maybe check for hyperdrenocorticism if that seems appropriate for anything else that's going on. Their PUPD, or they have hair loss, or any other reason to check that. I wouldn't do that routinely, but it can help because that can drive appetite and also give them a pot belly. Maybe a photo of the pet, and I will say good lateral photos are very hard to get. The pets sit down and they wander away and things, but if you can get a good one, or if the owner has one as a starting point, that's always nice to have to compare for later. So making a plan, this is a question I get a lot too. How do I know what weight? How do I know my target weight, my ideal weight? And I would say this can be difficult to judge. So roughly speaking, each point of the body condition score using a 9-point scale is about 10% extra fat. So animal with a 7/9 body condition score has about 20% too much fat. Roughly the weight at 1 year of age will work on a lot, especially for cats. I've been getting more overweight puppies referred to me, which I find quite concerning. But if you do have the data in your clinic and you know they were pretty good weighted around 9 months to 1 year of age, especially before they were neutered, that can be a good rough goal. Just take your best guess. We're going to adjust as needed. This is a long-term project, so you can adjust as you go along. So how much to feed? There's a lot of different formulae for this. I like the resting energy requirement at ideal weight. Again, I'm guessing at the ideal weight, but that's my starting point. There's a lot of variation in the calories that any of us need, so we're just going to come for a starting point, and this is resting energy requirement using the formula body weight in kilos to the 0.75 power times 70. And you just need a scientific calculator, which you probably have on your phone. Some people use 60 to 80% of the daily energy intake at ideal weight, which means you're going to multiply this by kind of a factor you're making up, and then take a percentage of that. That seems kind of circular to me, but if that works for you, that's fine. 80% of the current intake, especially if it's one of those animals that seems to live on air, sometimes the other formulae won't decrease the calories enough. You need a good diet history to do that, though. Remember that cat licking the gravy. That's going to be hard to calculate that. So how do we want to lose weight? A lot of people say the owners get fed up if it's not fast. Honestly, that hasn't been my personal experience, but maybe it is for some people, that they want their pet to lose weight really quickly. Consequences of rapid weight loss can increase. Sorry, I don't know, I went backwards there. I just want to see if I had it on the slide. So consequences, the faster you lose the weight, the more lean body mass you're liable to lose. Slow weight loss tends to be a better loss of fat. And while we always talk about weight loss, it's actually fat loss that we want, not lean body mass. You'll always lose a bit of both, but the faster you lose weight, the more liable it is to take in some lean body mass or muscle as well. So set realistic targets. Research labs or research facilities can get up to 2% of body weight per week. Most owners don't reach that rate. So I'm pretty happy at 0.8 to 1.5 even of weight loss per week. In cats, I'm happy if they're even slower than that, as long as it's steady and we're more or less heading in the right direction. I don't worry too much if we're meeting an absolute percentage goal. So in there someplace, 20% over 18 weeks. One of my cats took about 1.5 years to get to more or less his target weight. So slow and steady works too. So what food? To talk about sort of these 3 approaches: feeding less of the same maintenance diet that they are on, using a light diet, or a therapeutic weight loss diet. Owners often say, can't I just feed less of what he's getting? If he only needs to lose a little bit of weight and you can maybe determine that treats are making up quite a few of the calories and you can adjust the treats, you might be able to do that. But the problem with some of these maintenance diets is if you decrease the amount fed enough to result in weight loss, there is a risk of nutrient deficiencies because you're also decreasing protein and calcium and everything else. And in one study by Gaylord in 2018, some of the things that were deficient were choline, methionine. We get too little of that, we're at risk for DCM, cysteine, selenium, EPA and DHA, the omega-3 fatty acids, some of the B vitamins, including cobalamin. So that has to be done pretty carefully if you're going to do that. I wouldn't decrease very much, or you could get into other deficiencies. Light diets. There was a study looking at using light diets. In order to claim light on the label, the diet has to have 15% than the adult maintenance diet of the same brand or a comparable standard pet food. So it has to be about 15% less. Sounds like a lot. It's actually not that much. These can work for a little weight loss. There was a study looking at using them where they fed 80% of the daily energy requirement for a couple of months, and the dogs and cats did lose some weight. They might be better for weight maintenance because even in that study, they had some deficiencies when they calculated these, and again, deficiencies in selenium, choline, potassium, and riboflavin were less than the NRC recommendations. The NRC, or National Research Council, recommendations are even lower than the FEDIF recommendations. So these were deficient, and yeah, they may not have shown any deficiencies in a couple of months, but I would not be happy feeding a diet like this at that amount for any length of time. So therapeutic weight loss diets, I am a big fan of these. They're lower in fat, they have increased protein, which can help support lean body mass and also promote satiety. They are often increased in carnitine, which helps metabolize fat. They have relative increases in some of those other nutrients like riboflavin and selenium, which were deficient in some of the others, so that they're not going to be deficient when you feed these to an appropriate amount. Some of the ones, especially the dog ones, have increased fiber, and this can help with satiety and also help decrease serum triglycerides. There are some nutrigenomic-based foods which can help the gene expression, not of POMC, however. So some of these, not these that I've shown, but some of them can be borderline in some nutrients. So if you're going to restrict them severely, kind of use some care doing that. So the therapeutic weight loss diets come under legislation now of what's called PARNUTs, or particular nutrients for therapeutics or dietetics. And these are labeled as for reduction of excessive body weight, and the energy value should be on the label. Dogs, we have some numbers on an as-fed basis, around 3 calories per kilogram, and dry. Cats a little bit higher. So how to feed them? So weigh the food. So what's a cup? Is that a cup? Is that a cup? Is it a beer mug? Is it a teacup? So we do know that it's much more accurate to weigh the food. So be exact, but be realistic. At the university, I often had students who very proudly calculated out exact amounts to feed, but the owner can't do this. So Yeah, 645, 650, you're probably going to need to adjust it anyway. Use smaller bowls. We do know that people and pets, people will eat less, pets will be fed less if they are fed in a smaller bowl. We want that bowl to look full, so use a smaller bowl. Increase the number of meals or even scatter feed. Especially with these dogs who may be hungry in between meals, this can help with begging. It also helps with their energy use, the amount of calories that they're using, well, to actually process the food. Automatic feeders can be helpful where there's multi-animal households, in this case, multi-cat households, and feeding toys to help keep the animal kind of entertained and to stretch out the length of the meal as well. They also move around a bit more when they're using a feeding toy than just eating out of a bowl. So how do we deal with treats, snacks, training rewards? Do we just tell the owner no? I have heard some people recommend that. I don't. The most owners, especially of dogs, do give treats and snacks, and that behavior will not change because we tell them not to do it. They just won't tell us that they are continuing. During COVID, there was a study that said, or a survey that said that over 50% of owners were giving treats for no reason. They're just home and there's the cat or dog, and it's something to do and a way of bonding with them, because the majority of owners of animals also have found that their pet has been a source of solace and companionship for them while they're locked down. So what we need to do is calculate the calories. We're going to calculate the total calories that they're being fed, and less than 10% of these should go for treats and snacks. So if you're going to feed, 500 calories, 50 of those you could figure might be able to go for treats and snacks. Discuss with the owners what they want to use, what they could use, give them some options for new and different ones. If they're using high calorie treats now, discuss other things they can use. Everybody has their favorite ones on this, and I'll just tell you a few that I've used or I've had owners report that they like. Frozen blueberries, one at a time, apple slices, cucumber slices, carrots. I usually use slices or baby carrots. Always worry about them choking on those too. Courgettes. I know one nutritionist who swears that cats like courgettes. I haven't tried it, but interesting to try. Air popped popcorn without any butter or oil. Watch out for the microwave stuff. It's not necessarily low calorie. Using a jar with daily treats, that takes a little bit of time and dedication for the owner to set those up. But if you have multiple people treating a dog or a cat during the day, that might help limit the number that are given. So they come out of this jar, not out of the bag, so you know how many you're given each day. Exercise and environmental enrichment. Exercise actually doesn't use that many calories. If you've ever got on a treadmill or a bicycle that measures the calories because you think you're going to burn off last night's pudding, it's really hard to get enough to do that. And it's the same thing for our dogs and cats. It can support lean body mass, which uses more calories than fat does. And remember, we want to maintain lean body mass and decrease fat. You get some insulin sensitivity improvement, which is good. It also can, in people, decrease leptin resistance. Leptin is a hormone that helps decrease appetite, and some overweight people become resistant to that effect. We don't know if that happens in dogs or cats, so whether that's relevant, I don't know. Recommended is 30 to 60 minutes a day. We do know that people are giving more treats during lockdown. They're also walking their pets more. However, it hasn't made up for it. You can't run away from a bad diet, so they're still liable to be overweight if you're giving extra food. But recommended 30, 60 minutes a day to help with fitness and lean body mass. As I just said, many owners are doing more dog walks during lockdown. Certainly in the neighborhood I live in, they seem to be. So when people are working full-time or have very long hours, or maybe they're working a job right now that's very busy, if they're not already doing 30 to 60 minutes, that might be too much for them to add on to their day. If they add on another 15 to 30 minutes, that's good. That's a start. And these don't have to be consecutive. So if it's 10 minutes in the morning, 10 minutes in the evening, that's fine. They can do other things besides walk when the weather's better anyway, swimming where that works out, playing with toys. And we do know this interaction improves the quality of life for owners too. They have more of a bond with their pet. They're more involved with the pet's care. So what's going to go wrong? Lots of things potentially. Ask the owners where they think there may be problems. This is a really good place to get the owners involved with the program. You know, go through your plan, exercise plan, your diet plan, how to feed, what to feed, and then say, where do you think there could be problems for you and your family with getting the weight off of me? Are there other people? I'm going to just come up with some examples. Obviously, your owners are going to have ones particular to their lifestyle. Sometimes there's other people feeding the dog. Grandma gives him cake on the weekends. Concerns about, they're worried the dog's going to be hungry. This is a common one. They're worried about they won't be able to give enough treats. They're worried about the dog begging, people, toddlers, children, other people dropping food on the floor, that they don't have enough time for walks or play. As I said, it doesn't have to be consecutive and you can just start with a little bit. They have concerns about weighing the food. For cats and small dogs, be aware that you can buy a spoon that has a built-in scale. This is actually a picture of the one that I use for my cats. And you can see it's about 15 grams per that spoonful, because the regular kitchen scales we have may or may not be sensitive enough to weigh out small amounts of food. Access to scales for weighing the pet. Again, this is my own cat on the baby scales that I bought to weigh him. So especially now where maybe they can't get into the clinic, or you don't necessarily want them in the clinic all the time, or for cats who hate to come in the clinic, or even dogs who hate to come in the clinic, being able to do this at home is a very, very quick and easy way without the car ride or the trip, however, into the clinic. And ask the owners, you know, these are just some examples. You need to be asking the owners for their lifestyle where there could be problems. And then actually have the owners help you come up with solutions as well. But you can make suggestions. So for begging, other rewards, I mentioned earlier, maybe scatter feeding if they're begging in between so that it takes longer to eat, feeding extra meals, petting or playing instead of feeding. Keep them out of the kitchen during meal prep if you can, and discuss what treats and snacks they might be able to use. I've heard of the wonderful behaviorist Dr. Tom Webb talk about behavior change. And one of the things that drives automatic behaviors that we don't think about, if you get up and have the same thing for breakfast every morning, you may not be making much of a decision about that. He said change visual cues, change things in the environment that remind you to do things differently. So move the food bag into a different cupboard. Put one day's food in a container, and this for my cat, because I was having trouble remembering how many times I fed him in the day. I put his day's worth, I don't store it in here. I know you're not supposed to store your feed in plastic. It comes out of the sealed bag, and his entire day's ration goes in that, so that at the end of the day, I don't give him another spoonful because I've forgotten how many I gave. I used to use a chart, but it was too complicated. Put the lead by the door. Every time somebody goes for a walk, take the dog. So you have to individualize each to the owner, obviously, but whatever works to kind of go through things that they can change in their environment to remind them that they're on this goal. So again, what do they think might help? Grandma feeds the dog cake, maybe leave grandma some low-calorie snacks for the dog. Agree on very specific plans. So they're going to weigh the food at what time during the day. There's going to be how many treats and what they are, who's going to feed the dog and when are they going to feed them, what kind of exercise they're going to get, what the weighing schedule is. And this is better if it's quite specific, according to another human obesity expert I lectured with once. So if you can say, I'm going to walk the dog at 8:30 Monday, Wednesday, and Fridays, and my husband's going to walk him at 9 o'clock on Tuesdays and Thursdays, that exact can be helpful. And write it down. We don't remember very much of what we're only told. If you write it down, if you have a visual of it as well, they can take it home, discuss it with the family. That's imperative to do that. Don't expect them to remember what you've told them. None of us do. We only remember about 15% of what we hear, even when we're trying. So follow up for the communication. We have your baseline data already, things you're going to monitor either for a phone call, a revisit, maybe an online revisit. It might be good to depending on how you work and how the owner works, whether or not they want to see your face and you want to see theirs, or even just a phone call. We're kind of all getting tired of Zoom a little bit, so maybe a phone call would be a nice change to just say, how's it going? Have you weighed, you know, Muffin? What is your weight? How is it going? Were there any problems this week? Body condition score, I do not expect that to change immediately. Remember, 1 point on the 9-point scale is 10%. So it's probably going to take a while before we see a change in body condition score. The owner should not be expecting that to change. Initially, you need to be going on weight. I meant to change this slide. I apologize for that. So we used to say every 2 weeks for the first 2 months. I would now follow up that first week. I would follow up within a week with a phone call just to see how it's going, keep them on board, keep the communication, keep the commitment on your part and on the owner's part. So write it into your work calendar or schedule that you're going to phone Mrs. Jones, you know, at 9 o'clock or whatever time on Tuesday to see how they're getting on, if there have been any problems. So kind of fairly intense for a couple of months, and then maybe every 3 or 4 weeks, depending on the owner. Some may need more support. If you are weighing in the clinic, ideally we'd use this on the same time of day and on the same scales if you can, because they can vary. If you can't do that, do what you can. Again, as I mentioned earlier, graph the results. The visual impact is much better than just numbers. Photograph the pet. If you can get them in the same position, that's great. As I mentioned before, I find getting cats and dogs, especially cats, to stand still so you can take a picture of them from the side very difficult. At least this Labrador, we got lying down pictures of them. It's a little easier to take pictures from the top down, which does correspond with the body condition charts. So I mentioned earlier that we often have failures with weight loss programs. So why do we fail? Well, fatter dogs are less likely to complete the program. Ollie hasn't been looked at in cats. I would assume that's the same in cats, it's the same in people. But we may not need to complete it as long as we're making some progress. That's beneficial. In one study, dogs fed dry food were more likely to reach their target weight. In another study, they found that cats might do better with wet food. So whatever works for that owner. Wet food is less calorie dense on an as food basis, and it seems like that helps with satiety for some cats. I don't know what's going on with the dogs. Maybe it's easier to measure out the food. And remember, some pets do have lower metabolic rates and are hungrier, and these owners have more of a struggle on their hands. And one study said that dogs fed commercial treats prior to the weight loss might need less calories during weight loss. It might be because they're continuing to get treats. Don't know the reason for that. When there are setbacks, so they've gained weight, they're not losing at the rate that we had hoped for. I know one nurse that I worked with had great graphs of how the weight loss progress got worse during the winter during snowstorms. She could chart it and it lined right up with the weather. So we all slip up. So just encourage them to keep going. There's no shame, there's no blame. Anyone who's tried to lose weight has had a slip up at some time, probably. Again, reinforce any progress is good. So this little pug who probably can't breathe very well, any weight we get off him will improve his quality and his length of life. So again, a majority of people regain lost weight again, in a very good program. Half the dogs regain the weight that's lost. So how come we gain it back? It's difficult because we're designed to maintain weight, not to lose it. On sort of an evolutionary scale, we're all still alive because at some point our ancestors survived a famine. So this is how our bodies work. We do know that the metabolic rate decreases with weight loss. It seems kind of unfair, but if you gain weight and it takes X number of calories to gain that weight and then you lose it, it takes X minus a factor to regain it. It takes less food to regain the weight than it did to put it on initially. Food efficiency increases, metabolic rate drops, and it doesn't necessarily normalize after you've lost the weight. So animals and people who have been heavy and have lost weight will always have a little bit of a struggle on their hands. And then owners give in, you know, this is the, oh, but those eyes look, the patting paw on the arm can be hard to resist as well if they get, or the 4 a.m. cat, which we all know about, can be hard to deal with. So the owners will need a lot of support with this. So the European Association for the Study of Obesity has recently defined obesity as a chronic relapsing disease, which I thought was really good because it does kind of reinforce this ongoing maintenance communication that we need to have. So one of the things that has been looked at is continuing with a therapeutic diet rather than a maintenance type diet or a light diet. So if they're on a weight loss diet, continue with the weight loss diet, fed at slightly higher amounts to maintain the weight. It seemed to work better than switching back to an adult maintenance diet. Continued communication and support. So every time they come in, we're going to make sure we're still on track, make sure they're still weighing it. If you can, keep up even monthly communications with them to see how the weight is going so that you can intervene sooner rather than later. And I think certainly during the time of COVID, we know that a large percentage of owners have seen weight gain in their animals. So I think as we come out of this, hopefully before too long, and start going back into the clinic, I think this is going to be a problem we're going to need to deal with in a even bigger way than we have before. So again, support their improvements if we are encouraging and positive with the owners so that the owners maintain a good self-image of themselves as a good person and a good pet owner. They are more likely to stay with the program and reach the goals than if they feel that they have done something bad by letting the dog overeat or letting the cat get into the chicken or whatever. Feeling like they've done something wrong is liable to make them give up, which is very interesting human behavior. So this is why I've sort of said we need compassion, we need support in a positive way and reinforce that they are a good pet owner by working toward having their pet at a healthy weight. And these are my two babies. You can see the one I do struggle a little with his weight, and my youngster who I don't think is ever going to gain weight because he's too manic. Thank you very much for listening. I hope we do have an opportunity to somehow handle questions with this later.